everybody to the 9th meetup of the Mental Health Innovation Network. Let's talk about AI in mental health, because there's the promise of it, there's the hype of it, there's also the concerns about it. How do we do it ethically, responsibly? How do we do it if it, we might not need to do it in certain instances, so why do it?
We're trying to take an open approach to it where we embrace it. We don't want to be scared from it or spend all of our time worried about what implications it has. We want to use it to help us do what we do better, do more of it. We don't want to use AI to replace those people who deliver those services. We don't have a choice about using AI. It's coming whether we like it or not, but we do have a choice on how we use it and what we use it for.
Good governance makes great business, and what we mean by that is there are competitive advantages to following these regulations. As of February, everyone who sells AI systems in the EU, uses AI systems in the EU, or uses AI systems or data from the EU that's going to be sent back to the EU, have to train their staff in AI literacy.
The thing that I'm personally most excited about is the opportunities for AI to look at different data streams that we have in our broad health ecosystem, right? Things coming from wearables, from our smartphones, from health records, right? And learning patterns across that data that can help us predict your kind of level of mental health.
We're really focusing on the things at the moment around efficiency and productivity. We see that as the real low-hanging fruit.
As a service delivery provider, we just cannot provide the scale of services we want to the people we want to when we want to provide them.
We're going to invest in companies that can scale globally. Not every company will do that. We need companies that can grow 10, 20 times over, so we're looking for specifically scale.
How do we leverage AI to do the jobs that AI can do better, but that gives humans more of an opportunity to meet with the highest risk patients? And maybe it's the case that lower, moderate level conditions can self-care successfully through AI.
Augmenting is absolutely essential, and replacing is really concerning. We need to preserve the vital human connection in mental health support.
I'd say, but it depends. It's one of those, because it depends who you target and who your audience is. But what we're seeing with some of the younger generations, actually, they're more open with the chatbot because we're explicit that it's a chatbot, and they know there's no one on the other end judging.
Of course, giant concerns around privacy, right? This is mental health data, some of the most sensitive and personal data that there is.
We've been thinking about our ethical red lines and drawing up some guidance that we're now going to be applying consistently.
We do think a lot about compliance with our NHS partners, who are often thinking about IG, thinking about the DCBs and all the DTAC and processes people have to go through.
NHS funders and local authorities, they're pointing at services like us and saying, with AI, why do I need to fund that helpline? Let's just get AI to do it. That's where we potentially see, in the not so far future, a drain of resources being taken away from the sector because they feel the value that we offer is now replaced with AI.
In the first instance, we're going to buy, not build, so we're going to be making sure that we're taking products that have already been tried and tested.
We are trying to upskill some of our team to start using some of the low-code, no-code AI systems so that they have an understanding of how these things work.
It really decreases the likelihood you will come with this beautiful product and have no one want it because you haven't thought about either your users, your customers, or indeed the pathway that will almost definitely be redesigned by what you're doing.